This episode is brought to you by Progressive Insurance. Fiscally responsible, financial geniuses, monetary magicians. These are things people say about drivers who switch their car insurance to Progressive and save hundreds. Visit Progressive.com to see if you could save. Progressive Casualty Insurance Company and Affiliates. Potential savings will vary, not available in all states or situations.
Sunday morning. With us today is the president and CEO of the Brooklyn Hospital, Gary Terrinoni. And I understand that there's a lot of things going on between New York and Washington and the funding of hospitals. Well, Gary, we know each other a long time, and we've always done good business together. Tell us what is going on with the reimbursement to hospitals.
Well, John, we just to preface it, we're 180 years old. We're the oldest hospital in Brooklyn. We were here before the Brooklyn Bridge. And over the years, we've developed into an effective and efficient safety net hospital. And what that means is we do provide a lot of care to our communities, particularly the underserved in our communities. And as a result, we've had, over time, developed a large patient base of Medicaid patients. And the issue with Medicaid is, unfortunately, in New York anyway, is the lack of adequate rate reimbursement for treating Medicaid patients. And it's gotten to the point where it's really not sustainable. And if you remember, like even back to COVID, our effectiveness really culminated in treating COVID. We were at the center of the COVID issue. We were the first hospital in New York City, actually, to put a tent outside so we could screen patients so that if they did have COVID, we could bring them into the hospital. But if not, we didn't want to commingle those patients. But being a safety net, and the problem is, since we treat 50% of our patients are Medicaid, we're dependent on the Medicaid or the state insurance program. And unfortunately, that reimbursement is not adequate to be able to provide the services to those patients. And that's really a dilemma for a number of safety nets in New York State. And I think over time, what you've seen is hospitals or systems just have to close, or they're really dependent on the state, to help prop them up so that they can keep going. And it's a time we just can't continue that. There's got to be some level of rate reform. Something's got to change. We can't be expected to provide care to those that need it the most. And that's probably where most of the costs for health care are going, into these underserved areas. But yet, they haven't found a way to provide adequate reimbursement to providers such as us to provide that care. If we could do that more effectively, if we had additional resources, we could provide more resources to minimize the issues in the communities and do more screening and provide better care. It would allow us to generate, update our facilities for capital. We're in and out. We have one building that's dated, I think, in the 1890s. So unfortunately, with the New York system, it doesn't provide to a safety net enough reimbursement even for capital. So, yes. And at the same time, John, expenses are out of control. And we understand, we deal with unions every day, and we appreciate the work that they do, and they've been real partners with us. But the increases that we provide to them, and including our non-union people that we have to keep on paying.
Gary, I think I have to understand it, and our listeners have to understand it, for some of our politicians to understand it. Is this because the difference on the budget crisis right now between the Democrats and Republicans, and the Republicans are saying we're not going to give them money to migrants that are not citizens, versus Democrats are insisting that everybody should get it?
No, actually not, John. What I'm really describing is an issue that would really exist prior to that issue. I do think, when I look at, like, even New York in particular, there probably are better ways that they could have utilized the Medicaid system. And what the tendency is in New York, for example, they put in benefits and they increase these programs without having the money to support those programs. One of those examples would be home health expenses. They started that program a few years ago, and now I think it's exceeding like $14 billion a year. Well, it might have been well intended, but what it's doing is it's not allowing safety net providers such as us and others to really get enough reimbursement.
So who oversees this entire thing? Is it the state or the feds?
It's really the state. As far as the state has a huge impact in terms of Medicaid, and a lot of that is supported by the feds. And I think what the feds are trying to do under the current leadership is to try to take out, for example, like fraud and abuse. And I have to give the current governor of New York, who's trying to do the same, for example, with this home health program. So I think, we've got to be more careful, including at the federal level, which I think they're trying to do, is to be careful where we're spending our dollars. And you can't spread money. So
what message are we sending to who on this interview?
Well, I think for the federal government, it's that they can't lose sight of the safety net providers in this country, and they do have to be aware that we need the resources for those providers, or else you're not going to see a reduction of healthcare expenses, because we're not able to really treat the people that are the most needy more effectively. And for the state, it's a very similar statement. Unless they provide the resources, adequate resources to safety net providers, then we can't improve the health of our community. And I will tell you, even though we are a safety net, we were just recognized by U.S. News and World a couple of years ago for one of the best hospitals. We've done a lot with safety in the hospital, so it can be done even with limited resources, but we need more. They can't look at safety net hospitals as the last resort. The other point I would make, John, is some of this is the haves and have-nots, and you have systems that are making tremendous bottom lines and a lot of money and spending a lot on health care without regard to the safety nets. And while we're treating the most needy, that's not fair either. You can't have a situation for the haves and have-nots. I'm from Baltimore originally, from Maryland. They had a good system. I was at Hopkins for a number of years, but their system was they cross-subsidized commercial insurance, for example, from the beginning. So if you go to Hopkins and you have a knee replacement, it doesn't matter whether it's Medicare, Medicaid, or commercial Blue Cross, they get paid the same amount.
So who in the state does that so we can direct it towards them?
Well, I've been outspoken about the Maryland system, how effective it is. It's an all-payer system. And I think at one point in New York's history, they might have had something similar to that back in the 90s, but that was discontinued. So you can't have a situation where certain systems, and they're great systems, they're providing world-class care, but then who's going to take care of the people that are the most needy? And unfortunately, most of those systems that are profitable aren't that interested in providing care to those people. Why? Because they know that the reimbursement is not where it should be. So I would say, John, we need rate reform. Somebody has to recognize in the state of New York, for the state of New York, they have to recognize these disparities and find a way to be fair to all the providers. And somehow they have to figure that out.
Thank you for the update, Gary Terrinoni, and the CEO and president of Brooklyn Hospital. And I'll try to direct it to people we know in the state health situation. Maybe they can help.
Thank you, John. And anything you could do on the federal level, because I think we're a shining example of how a safety net can operate, because we are efficient and effective. We provide good care, so they can't lose sight of the people that we treat on an everyday basis that need us the most.
Thank you so much.